Okay, so this is a drainage technique for head and neck cancer. If you've had any lymph nodes removed in the neck, how to drain the lymph from gathering in the neck, and you're going to drain it to viable nodes underneath your armpit in your axilla. So you're going to start off by clearing your buckets, which are your two big dumping points in your neck. Find your clavicle, your collarbones, find the inside part of the collarbone. Cross your hands over. Now, if you just go behind that inside part of your collarbone, you'll find if you lift up your shoulders, you can feel it quite easily. You've got two little caves your fingers fall in, that's your buckets. So you're going to do little circles. They sometimes feel like you've got little grains of sand or little peas in there, that's your lymph nodes. So little circles 5 times each way, or for one way just feels best, just that way. Just you clearing your buckets before you fill them back up. So clearing your buckets. Then what we're going to do is a bit of tummy breathing. So there's a lot of lymph nodes in your tummy, deep in your tummy. So by placing our hands just in our tummy, take a breath in, take a breath out, resist pushing. Now when you breathe in, don't move your hands, resist. Feel your tummy pushing against your hands, and on the out breath, pushing your hands back down. Moving your hand a bit further down. Okay, breathing in, breathing out, resisting in with your hands, pushing in slightly. Breathing in and resist against your hands. Try not to let your hands move, and breathe out and push in a little bit further. Then you do 2 more positions, one there, one there. So you're working on all the deep channels of the lymph system in the tummy. Now you're going to clear your axilla nodes underneath your armpit. So use your sort of cupped hand underneath your armpit, and you're pumping little circles. You're not sort of moving your hand anyway, you're just encouraging those lymph nodes under your armpit to get moving. Okay, so now we're going to work to drain the swelling in the neck, wherever it may be in the neck or the face. We're going to start distally and work our way. We're going to clear, it's like a car park, a full car park. If this is all full and this is the only exit, you've got to clear these cars first before any of these cars can be cleared out of the car park. So we're going to start with our chest. There's a lot of good lymph nodes in your chest too, but we're going to drain downwards towards that armpit. 5 to 8 times like that, and as you sort of work your way up a bit higher, this usually would do without clothes on. It's easier to do just straight onto your skin. And it's quite a sort of gentle movement, nice contact, but the lymph is just underneath the skin. So you're pulling it downwards 5 to 8 times. Okay, now taking it a little bit higher. Again, if this is where the swelling is, make sure not to finish the stroke on the area. We don't want to direct and stop at the area. We want to go past to the viable nodes. So I find it's easier to do the side of the neck with your neck slightly turned. So doing little cups, dragging downwards, dragging across from underneath the chin, across the neck, but always finishing as you go downwards. Cross, cross. If the swelling is just on one side, you can just do the one side, or if you find it easier to do both sides, like with this one where you stretch your head back, going down around the thorax, so you don't sort of press too hard on your trachea there. Okay, and now you can do little pincer grips. There's a lot of lymph nodes underneath your chin. Pincer grips outwards, just grabbing that little channel on top and around your jawbone, out to the ears, and then from the ears, we're going to take it down again. So always directing downwards, you lift off, you're not coming back up. Always down, finishing at those underneath the armpits, axilla. And then there's lymph nodes in front of the ear and behind the ear, so you can get your fingers, either sort of 2 fingers each side, or 1 finger each side if you find that. I find that quite difficult. So yeah, you can do little sort of pumps there, and then bringing it down, make sure not to stop again at the area of the swelling, and then again, down. Not forgetting the back of the neck, You know, there's a lot of lymph nodes coming from the occiput, underneath the back of the head, down, down. Okay, when you feel like you've had enough, make sure your last stroke's always down, and then we're going to give a little last pump, clear some of the nodes under the armpits. Last pump of our buckets to clear our buckets. So find the corners of your clavicles, lift your fingers up, forget the little caves. 5 pumps, either one way or the other way, or both, whatever. And then finish with your tummy breathe in. 1 position, 2 positions, 3, 4. And that's it. All should take you probably about 10 minutes each day if you can in the morning. After you get up, because often the swelling will have increased overnight in your head. So just to get all that clear, and you feel a lot lighter after that has all been built up. So that should be a daily practice if you can. Okay, thank you.